Ladies and gentlemen, I'm very happy having the possibility to say a few words about the system of clinical osteology care in Czech Republic. And I would be happy to connect it with a short expression about the medical and scientific support of the Ukrainian people in the Czech Republic. I'm very proud having the possibility to speak to you, and I hope that our contacts now and even in future will be very good and cooperative. So let me start with my lecture. I will start with system of clinical osteology in Czech Republic, speaking about these main topics: epidemiology, diagnostic and therapy, some few words about our disadvantages, and with a starting of population program. And at the end, I will comment Ukrainian situation and Ukrainian refugees in Czech Republic. So, osteoporosis prevalence or epidemiology in the Czech Republic. To be honest, we do not have any very actual data. We have some data from 10 or 15 years ago, but in any case, we can expect that as in other European countries or around the world, about 7% of the population of the Czech Republic will be attacked by osteoporosis and metabolic bone disease. To inform you, Czech Republic has about 10 and a little bit more million of inhabitants, so it represents about 750,000 patients with osteoporosis. And the number is still increasing and will be increasing in the future. One of the reasons is that our population in Czech Republic is quite old, to be honest. If you look into the population of risk, you can see that in our about 10 million inhabitants, we have nearly 4 million of people which are older than 50. And they are at the risk of developing of osteoporosis. And even more, about 1 million of inhabitants is older than 70. So it's very high risk group, about 1 million of people which are in a danger of osteoporosis and other diseases which are closely connected to the older age. So what to do with that? We must have some tools for diagnostics and therapy, of course. Speaking about the diagnostics, the classical diagnostics is dual energy absorptiometry with measurement of bone mineral density, and if the results of T-score, we simplified it, less than -2 and 5 is a diagnostic for osteoporosis. We also accept an osteoporotic fracture in a history of patient if it is really osteoporotic. It means a low energy fracture in older age. On the other hand, we have only about less than 100 DEXA machine in our country, which is 1 to 100,000 of inhabitants, which is not enough definitely, and we have some problems with that. On the other hand, we are one of the very rare countries around the world in which we have developed is medical specialization in clinical osteology, quite official, like internal medicine, surgery, endocrinology, orthopedics. We have a medical specialization in clinical osteology. But we definitely need to attract our general practitioners, gynecologists, and our medical specialists to help us and to take care about the patient with osteoporosis in the country. Speaking about the therapy, I can say that we do not have any problem. We have full access to the therapy, which is fully reimbursed by health insurance companies, so it's no problem with the therapy. Most of the drugs we use are the denosumab, the whole spectrum with bisphosphonates, teriparatide, and we are looking for some development in future too. But our spectrum of therapy is quite full. On the other hand, we still have a very big diagnostic and treatment gap. And we definitely are on a bad end. We are one of the worst countries in Europe, having about 80% of undiagnosed and untreated people with osteoporosis. It's bad, and we try to do something with that and resolve the situation. And we have been quite successful with the start of population program. With cooperation with gynecologists and general practitioners, with a quite big support of health insurance companies, which are willing to reimburse that, we started this April population program, in which is obligatory screening for each woman or man in an older age. We are speaking about the women after the menopause and men over than 65 years of age. And we use FRAX as a questionnaire, DEXA measurement, and treatment if necessary. This population program is just about to start. I have told that we started in April this year, and we hope it will deeply improve the situation in osteoporotic care in our country. So I hope that our clinical osteology in the country is well developed and has some bright future. And I hope that we will be able to cooperate with Ukrainian scientists and colleagues and share our experiences and be in close touch. Let me say a few words at the end of my lecture and comment to the situation in Ukraine and terrible war. I have presented some data which are just my personal opinion and personal statement in Osteoporosis Forum in Austria this April. So just to repeat it and say what I definitely know and what is my personal feeling. I would like to speak about the Ukrainian refugees in our country, healthcare for Ukrainian people here, how we cooperate with Ukrainian specialists, and how it is with clinical osteology in the long time. Ukrainian refugees in the Czech Republic, we have about half of million of refugees in our country. And from the early beginning of the war, we developed very good system of acceptance of the refugees with regional centers on which each refugee was registered, obtain a visa, accommodation, definitely with financial support, and the healthcare, which is fully reimbursed, like for Czech people. In each hospital, we organized so-called UA points, just to make the access to the healthcare in our country easier for Ukrainian people, which have some language barrier, not so bad, but definitely there are some language barriers there. But we did our best to cause the healthcare for Ukrainian people. I would like to give you some examples from our university hospital. Up to now, we have delivered healthcare to Ukrainian refugees nearly to 3,000 people. Now it's a little bit older data. Nearly half of them were children with, I'm very happy, just common colds and not so difficult cases. Mostly it was outpatient without necessity to be hospitalized. And we are very happy that we have, in the last year, 54 small babies from Ukrainian women, which delivered in our hospital, and we support it definitely very much. Speaking about the cases which need to be hospitalized, there were some deliveries, of course, some people with oncology diseases, and I can say that the people were treated in Ukraine, and we continue with a therapy which is quite similar like in Ukraine, and I can say that the oncology care in Ukrainian people is on a high level, even in Ukraine. There were some diseases of gastrointestinal tract, cardiovascular disease, and so on, but not so bad, definitely. In the cases for outpatient clinic, there were oncology people, some traumas, of course, respiratory diseases, gynecology, and quite much dentistry and stomatology needs. We have been looking also for Ukrainian healthcare specialists, for physicians. There were not many here in our country, in our city. We need to verify Ukrainian education and do some approbation tests, and there is still some language barrier. Speaking about the nurses, we are quite in shortage in our country, and we will be very happy if some Ukrainian nurses can help us, but we prefer if somebody decides to stay here for a long time with some stability, of course. Few words back to osteology in wartime. In the Czech patients, there were no change, no problems, nothing changed. And speaking about Ukrainian people, they were mostly younger persons and just occasionally need some osteology care. So there are no problem in clinical osteology during the wartime. To close and finish my lecture, I would like to say that we developed as a country and a people in the Czech Republic extremely high solidarity with Ukrainian people and Ukrainian refugees. There is a big support. Many even physicians propose the accommodation in private houses for Ukrainian refugees. We delivered huge money and charity to Ukraine with military techniques and financial support and healthcare support and so on. And I would be very happy to say that the Ukrainian people are really heroes, and I wish you all the best and win in this terrible situation and war. Thank you for your attention.